Oh, okay. The meeting's being recorded. I want to start out with what we sometimes term our sort of superhero origin question, which is to ask each of our experts in turn how they first became engaged in this interface between climate change and cancer. So we'll go Leticia and then Tracy and then Gila, and would just love to have your comments. Welcome and thanks so much for joining us.
Thank you so much for the opportunity for being here. I think that my event that really pushed me towards working more on this field was Hurricane Harvey. When Harvey hit, I was working at the Texas State Health Department, and I really was able to see firsthand the impact that the storm had on access to care. There are several large cancer centers in Houston, and it wasn't the first time that Houston was impacted by a hurricane, but Harvey was different, and now we know that it was different because of climate change. Warmer air holds more water, so Houston wasn't so much about the impact of the winds, but the fact that the storm stalled over Houston and it rained and it flooded, everything flooded. The hospitals thought they were prepared, they had backup generators, and the backup generators flooded. And so that was the first time that I really saw the impact of climate change on access to cancer care. And then, of course, the hospitals weren't the only thing that Harvey flooded. Houston has a huge industrial area that was also flooded and released large amounts of carcinogens from oil refineries and the Houston Ship Channel around the community. And if you think about it one more step, why were those industries even there? They're there because of our reliance on fossil fuels, right? So it was one of those moments where everything came together and it became a priority for me to work.
Gotcha. Thanks so much. Tracy, your thoughts on that?
Yeah, so I think I'm a little bit more unique in that I was actually not thinking about climate change firsthand as my traditional research story, but I, relocated to the University of Miami, and being in South Florida now, you can't not think about climate change. And so in my role now as a co-leader of cancer control, this is something that we're trying to bring and integrate to the forefront of our cancer center, because climate change really impacts everybody, but it impacts people disproportionately. And I think for me, this is really here in South Florida and with our research program where we're really trying to focus some of our efforts. So I'm newer to the field. However, I think there's a significant call to action, in particular with cancer control and cancer prevention.
Thanks, Tracy. And Gila.
Thanks, David, and Leticia and Tracy. I guess I first became actively involved in the climate change and cancer. Well, it's more the climate change, space, and implementation science intersection, which is when a group of climate adaptation researchers were interested in implementation science because they were thinking about implementing early warning systems, which I'm sure we'll hear later from Leticia and Tracy a bit about that. But they were struggling with some implementation challenges, and so they wanted to know more about implementation science. And a few months into that collaboration, my house was flooded. So as a result of, the local storms here that were unprecedented in terms of the flooding in Rockville. So that piqued my interest in thinking about climate change and implementation science. And then there's also this trans NIH group, and I'm going to post a link in the chat, that's been thinking broadly about climate change and health and NIH involvement. And so within that group, there's a subgroup at NCI, and I believe my colleague Heather D'Angelo and possibly others who've been very active in leading efforts through that group have been thinking about that intersection between climate change and cancer. And actually another colleague of ours, Sally Weaver, is a program officer on a funding opportunity now that's looking at the impact of disasters and weather-related disasters on cancer care. So yeah, that's sort of essentially the ways in which I've become interested and gotten engaged.
So thanks to the three of you, and it again sounds like obviously there's some broader issues in terms of climate change and health. There's clearly in your words this attention to equity, or rather there are inequities that arise as part of the influences that you're seeing from climate change, disparate populations being affected differently, different areas of the country. And I guess what I'd love to unpack a little bit more from each of your perspectives, for those of us who haven't been as directly tied into some of those linkages between climate change and cancer, if each of you might be able to answer the question for us, what we should all be thinking about in terms of some of those connections. What are the most compelling connections, or the things that stand out for you as you think about climate change and cancer and how they intersect? Maybe we can start with Tracy and then go to Leticia and then Gila.
Yeah. So I think, you know, for me, when I think about it, there's not exactly a straight line between climate change and cancer. It sort of goes here to there and here and then back around, but you can definitely see the connections once you start looking and you see it. And so I think, you know, everything from how it may impact cancer care when a disaster strikes, to things that it may be actually increasing cancer risk because of things like Superfund sites that are now exposing heavy metals and contaminants into the water. So I think it's not a linear straight line like we see in some of our other cancer elevated risk stories. But if you start unpacking it, I like that word, David, you really start to see it. And I'll pause there because I think others have other comments too.
And I think that whenever I see it with the cancer care continuum in mind. So as Tracy was saying, prevention, cancer risk, definitely increased exposure to carcinogens through our processing, extraction, processing, transportation, consumption, and waste that's generated during fossil fuel activities. Especially, there is an environmental justice component here because communities in proximity to these sites tend to be those communities that have been targeted for marginalization. Then there is access to cancer care, and we were just talking about disruptions in access to cancer care during Harvey, and the inability of patients that are undergoing treatment to access the healthcare facility. And then cancer, or individuals who have been diagnosed with cancer, are vulnerable populations because of the health consequences of the cancer diagnosis and treatment. So some chemotherapy agents, for example, I make it more difficult for people to thermoregulate, which make them more vulnerable during a heat wave, or decrease their immune capabilities, which make them more vulnerable to infections during floods. So then there's a component there during cancer survivorship as well. So I think that in every step of the cancer continuum, you can see how climate change is leading towards health.
Great, thanks, Gila.
So I just posted I was just, as I was listening to Tracy and Leticia, thinking about this nice overview that Bob Hyatt, our former deputy at DCCPS, recently published. I think it was in Lancet Oncology, on the link between cancer and climate change. And Leticia, when you were talking about looking across the continuum, he has a very nice figure in there. And I don't know, I don't know if I can actually share a figure in the chat, but it really does. It's a beautiful summary of across the cancer continuum, ways in which climate change is, can impact cancer risk, cancer diagnosis, cancer treatment, etc. And I do see, David, a comment in the chat from Stacy Loeb, which I hope you don't mind if we direct our attention to for a moment. Yes, meat consumption.
Sure, go for
and
it.
The possible. Yeah, so she mentions the link where meat consumption is a risk factor for both cancer and climate change, and the possibility of simultaneously tackling both major societal issues through systemic efforts to alter dietary patterns. Yeah, I think it's an excellent point.
I mean, I think it would be a great collaborative effort on multiple fronts, right? So lifestyle behaviors, we know in particular meat consumption definitely elevates cancer risk, in particular colorectal cancer. And so if we could have some sort of combined effort, I also think about sometimes you come in through the back door with behavior change, and maybe if you can entice people with that they're helping the planet alongside helping themselves. Perhaps that's a strategy. I think that's a great point.
Yeah, I agree. And also, go ahead.
No, you go ahead, Leticia.
Yeah, so I think that whenever we think about emissions from red meat are the largest, right? The entire dietary industry. So if you think about how many emissions during the production of feed, transportation, pesticides, antibiotics, the feedlot practices, the emissions are very significant. And then, of course, there is a health hazard in consuming red meat, as Tracy mentioned, especially with colorectal cancer risk. And yes, there is, I think, space for individual level approaches to diminishing red meat consumption through our recommendations for behavior. There's also an institutional role. If healthcare institutions or research institutions were to implement something like Meatless Monday or reduce the serving of red meat consumption at this site, I think it goes a long way, similar to how you're not allowed to smoke on campus. If you had more of a shift towards leading by example with the institutional practices, it could have a huge impact as well.
Great. Yeah.
And I think it's sorry, just one last point, and I think it's a really interesting issue because it I think as it relates to dissemination science and in terms of framing, like how you're communicating a message or motivating people to do something. I think Jim Deering did some really interesting work looking at policymakers and specifically, political appointees and how you can frame a message for motivating them to pass legislation regarding climate change, depending on whether you make the linkage with the environment versus health, and what motivates them to take action is influenced by their political constituency. So similarly, I think whether people will be motivated to change their meat consumption patterns, maybe they're not going to be as motivated by health, but maybe they'll be more motivated by the environment. So I think it'd be interesting to explore how, given these, varying, the complex problems that meat consumption is related to, that we may find different ways to motivate people based on all those different factors.
Great. So thanks for all of those comments. Thanks also for the question and actually the support for the question within the chat. It just shows that as you put in these questions, as they come in, we are more than happy to take them on. So thanks for that. And even in the answers, what I saw, or at least what I heard, was this notion of, for one thing, it's across the cancer continuum. So thinking at every stage as we're focusing on prevention and we're focusing on screening, early detection, diagnosis, on through treatment and its effect. And then at the same time, I think, Gila, to your point, there's a range of dissemination and implementation questions that come up as we think about some of the challenges as well as some of the solutions and how they might be implemented in the case of interventions, or how messages may be communicated, received, interpreted, and used. To push that a little bit further, what I'm curious about, and thanks also for putting the paper, Gila, from Jim on multi-solving interventions. What I'm curious about in pushing a little bit more on the anchor points for us in implementation science, some of the things that we've been talking about of late with regard to a range of our interventions are, how do we get them sustained? How might they need to be adapted in different contexts or with regard to the needs of different populations? Even how might we need to de-implement certain interventions in order to make, either because they're harmful or to make room for other things that might be more beneficial. I'm curious if each of you might have any comments, and Gila, maybe we can start with you, and then Leticia, and then Tracy. Any comments of those, whether those kind of issues resonate as you think about climate change and cancer? So whether it's, again, sustainability, adaptation, de-implementation, what comes to mind as an anchor point where we can say, yes, that's something that we ought to all be focusing on together? So Gila, you want to start?
Sure. So there's actually a nice example where this is being done in the clean cook stove space. And there, you know, because this is very much about particulate matter, which contributes to climate change and as well as cancer risk or, you know, lung disease risk and thus cancer risk, as well as heart disease risk and a whole range of health problems. So there have been, I guess about 6 or 7 years ago now, the clean cook stove research community that was focused on trying to replace stoves that were generating significant amounts of particulate matter, household air pollution, which also contributed to community level air pollution, with cleaner cooking technologies. And they realized that a major challenge was actually not just getting people to use the stoves, the new stoves, but to stop using the old stoves. What they found was people might use the stoves, but they would often do so in addition to the old stoves and just have multiple things going at once, or use the old stoves for one thing and the new stoves. So this really highlighted a challenge to think both about de-implementation and implementation together, and which that community has been thinking quite a bit about. And I, you know, again, be happy to share some papers in the chat that have come out of that effort. But I think that's one like very clear example of a nice opportunity linking these areas that are specifically attending to some of the key issues in implementation science around de-implementation. And also, obviously, adaptation has been a big piece of that as well, as you think about the different communities and who are implementing these things, as well as sustainability. And, you know, this also has to do with fuel supply issues. And so you can just imagine these similar types of issues being applied to a range of areas across, you know, climate change and cancer, whether it's forecasting systems or preparedness or what it is.
Great. Leticia.
Yeah, I think as we were talking about opportunities, one of the biggest opportunities that I see that we could do better is at the interdisciplinary or getting different departments or thinkers to work together. So for example, when we look at a shift towards clean energy, especially in healthcare facilities, and I'm sure you know that the healthcare system is the second most energy intensive industry in the US. So shifting towards clean energy sources would have a huge benefit for climate change. Also, if you have these energy sources being produced locally, solar panels around healthcare systems and things like that, then whenever there is a loss of power due to extreme weather events, that also increases the resiliency of those facilities to these extreme weather events. However, you almost never get the sustainability officer to talk to the emergency preparedness plan manager at these facilities. So getting these people who are making decisions for which the solutions might be overlapping does not happen, I think, at the level that it could right now. So that's a huge opportunity.
Great. So sort of cross-sectoral, as well as thinking about the sustainable plan for some of these systems so that it might not be reliant on a single person or, you know, a single entity. Okay, that makes sense. And Tracy.
Yeah, so I think I'm going to build on Leticia's example here, and I think this is something that we're starting to think about here at Sylvester is, you know, do patients have a disaster plan in place, right? So if you're getting treatment during hurricane season, could we implement some sort of across the board standardized question that's being asked? You know, we did a very good job at distress screening, right? As an example, across cancer centers and across patients. You know, is that something we could be implementing to make sure that continuation of care, not only at the system level, like Leticia is talking about, does the center even have a plan? But then at the patient level also, what is the plan? And I would also say that, you know, it's not just unique to coastal cities. I mean, you think about the Northwest, and droughts are starting to have increased fire risk. You know, these disaster plans are cross-cutting that are related to climate change, that are not just hurricane, but tornado, fire, I mean, all of these things are related, flood. So that's one thing I think of too as everybody was talking.
Thanks for those comments. And then I noted in the chat the sensitivity, the potential cultural sensitivity to different interventions so that they don't miss some of the celebratory reasons why, we engage in different practices. Curious if any comments just about, again, with an equity lens toward all of the different interventions that are being proposed. Anyone have any thoughts about that?
Yeah, I think that we were talking initially too about warning systems. And in my experience working in Texas, I really saw how, for example, the language in which these warning systems are deployed is extremely important because it won't reach every population. And a lot of times populations that are left behind are the ones that are at higher risk. So, and also being culturally sensitive in the way that these are presented. There are some society expects different roles from different people. So there's some gender there too, where you can see that a lot of times the response to this warning system is very different by gender and by racialized group. So I think that being culturally sensitive in these warning systems during an emergency is extremely important, similar to what Gila was saying about tailoring your message for mitigation efforts to your audience. There is a huge need to tailor more urgent messages to your population, especially those who are more likely to be vulnerable.
Yeah, and just thinking about the specific comment from Carlos, yeah, I guess a couple thoughts in reaction to that. So one is this idea of, do we have to completely eliminate, or is there some ability to, moderate, obviously? That, as well as it made me think about also how in energy, how we've really shifted. I mean, industry has kind of led us in shifting from coal to wind and solar, and that's just where, that's what's profitable now. That's where there's just increasing demand and increasing supply, and I think industry is actually really leading us there, sort of almost maybe ahead of government. And granted, I'm saying that with quite a bit of ignorance, but that's my understanding from what I've read and heard people say. So similarly, it's amazing to see now that this alternative meats, like vegan meats, like the technology there is like mind-blowing, honestly, how we've come to create these products that you can't necessarily tell, although I'm sure people will always say you can tell, but there's, I mean, I think that there are just a lot of alternative options now. And so maybe, yeah, thinking about, yeah, I think it's a great point in terms of, culturally tailoring the message and being sensitive to of these issues, while also recognizing, opportunities to take advantage of the innovations that society has in ways that can be culturally sensitive. So I don't know if that makes sense, but I'm trying to like have it all, I guess.
Yeah, I think too, it also speaks to the point of engaging communities and stakeholders as we design these interventions, and going to the communities and talking with them about, here is an idea, what do you think about it? And maybe the messaging is making it, if meat consumption is something special for a celebration, it's really special because it's done for that thing in particular, but maybe the rest of the time we think about the meatless Monday or whatever would be acceptable. But I think going back to the communities is critical for all of these, not just the meat, but also thinking about, as Leticia was saying, disaster awareness plans and all of these, listening to the needs of your community is important.
I wanted to add, if I may, I'm sorry, I haven't seen Carlos' comment on me, and this is one that I think I spend a lot of time thinking about. I'm originally from Brazil. If you've ever been to a Brazilian restaurant, you understand how big of a deal red meat consumption is for us. So I wanted to be clear that it's not, sometimes you hear people say, so we should never eat this again. It's not the cow, it's the how. And I think that's what Gila was getting at. The how we're currently producing, how red meat production is currently working that is problematic. It's the how and the how many. If you see how much meat we're consuming, the way that it's being produced, that's where the problem is. So I think that there is no shaming or blaming that we should place anywhere in association with red meat consumption. And of course, we should be culturally sensitive. The problem is not the cow. The problem is how we're producing it and how much we're consuming. And I think that any type of cultural interaction, there is space for that understanding that you can continue to consume it. You will always have a role, I think, in our diet. However, it does not need to be produced in this manner, and we do not need to be consuming as much as we are.
So thanks to all of you, and by the way, here's lovely pictures of the fireside or campfire that we have pulled our chairs up to. So appreciate the visual to just keep the wonderful conversation flowing. Out of these comments, I do hear as links to some of the things that folks in implementation science are thinking about is, there's constantly innovations that Gila, I think, as you were saying, that are occurring, that are developing, and certainly the idea of how they best integrate into local context. What is the need for them? What are the opportunities, and how can they best meet the outcomes that will help us all over time? And so it's the range of different sectors that may be involved. It's a range of different innovations, and then it's the sensitivity and not just sensitivity, but the engagement of people who are who have that expertise in terms of what works for us in our community, in our system, et cetera. And so, no, thanks for the nuance, I think, resonates among a group of people who recognize that often things that presumably can just be pulled off a shelf and plunked into any system do not so easily fit. So thanks for that, and really appreciate the question that started. In fact, there's another question that I think reflects on prior discussion that I'm just going to go to, that you mentioned carcinogens mobilized from industrial and hazardous waste sites with flooding. How do we address them prospectively? So again, moving into more of the proactive space, whether it's storage, safer alternatives, et cetera. So curious, Leticia, Tracy, Gila, any thoughts about getting ahead of the challenge, right? Building in resilience, safety, et cetera, into some of these potential exposures before they happen?
So I can just share that here in South Florida, the Seminole Indian tribes, their land has some of the largest Superfund sites associated close by. And so trying to work and be the conduit to reinforce and try to, I know the Environmental Protection Agency has, a big initiative to try to help protect and not have when these large, flooding events happen, to prospectively try to protect, right? And so I think that's where there's a unique opportunity for things like our population science and our cancer control and community outreach and engagement programs to be thinking about this multidisciplinary team that we could bring together, beyond our traditional scope of how do we be the conduit also to these communities to help protect them prospectively. I think that's a great point. And if we know these sites exist, how do we go in and try to help, shore them up now?
Great. Any other thoughts? The kind of prospective, proactive, what can we do ahead of time?
I think that one of the things I think research and our understanding really contributes to is how proximity to these fossil fuel industries really impact, as we're saying, throughout the cancer care continuum. And we kind of miss that for the question, and how do we solve it, right? So I think that some of the setback requirements, so the distance that you cannot develop new fossil fuel infrastructure in close proximity is one of the ways. That has not really been, I think, as well implemented or as frequently implemented as it could be. And that's one of the ones I believe with one of the biggest potential here.
Great, thank you for that. Sorry, Gila, did you have anything you wanted to add?
Well, just I'm thinking about how this highlights, the importance of having sort of data systems where we can even be tracking what are the health consequences of these things so that we have the data to sort of make the case that these changes need to be made, they need to be prioritized. Also to help inform those sort of proactive forecasting systems to deal with or get ahead of the challenges to try to limit exposures or mitigate consequences. So yeah, that was the only thing I guess I wanted to add.
Okay, great. And I'm seeing continued comments in the chat, which are really wonderful. Again, speaking to the importance of thinking about equity, the importance of thinking about even the long-term consequences of different innovations that are occurring, and definitely whether there are analogs in terms of how we think about, in this case, it's meat consumption, but in terms of how we think about things that may have a really important ceremonial or cultural significance, and also nice to see people connecting with each other on chat as well. So I do, because each of you have spoken about the opportunities or thinking about engagement of a larger team, given that a lot of the folks who are listening in may be thinking from an implementation science perspective, how can I engage with some of our folks who are focusing on climate change and cancer? And just curious if you have any thoughts, any suggestions about different strategies, different either locations, or how do you think we could potentially build more engagement between implementation scientists and climate change and cancer researchers? Any thoughts come to mind? And maybe Tracy, we can start with you, and then Leticia, and then Gila.
Yeah, so I think, again, bringing it to the forefront, one of the comments that was made at ASPO when we gave this session is, it's up to us to bring it to the table, right? As Cancer Center members, to bring the conversation of climate change to the table, but then to keep the conversation going, right? It's not just enough to bring it to the table. So I think that's part of it. But I also think bringing up this idea of like symposiums. So for example, this next Friday, Leticia will be there as well. We have a climate and health symposium that's happening at the University of Miami campus. It's open. I think we have a link that anybody can attend. It's free. It's offered by Zoom. I think it's Zoom or WebEx. But these kind of areas where we are bringing together people from atmospheric science, we're bringing engineering, we're bringing people from the healthcare space. This is a large problem, and it's going to take all of us coming together and putting our thinking caps on to really try to solve the problem.
Thanks, Tracy. Leticia?
Yeah, we definitely need all hands on deck for this. And I think that the NCI can play a central role here in convening these people who have very different backgrounds, very different expertise, but should be working together. They just don't know how to find each other. I think that NIH and the NCI, especially when it relates to cancer, have the opportunity to be leading some of these interactions. We participate in several groups that have similar interests. The Medical Society Consortium from Climate Change and Health is one of them. And I think that just having a listserv or, once a month or once a quarter kind of meeting to check in and see, or have somebody who has had a project or a publication or update, give, a 10-minute talk or something, just keeps the conversation going, as Tracy said. It's extremely important. And you can, be engaged in these. It won't take a whole lot of your time. And every now and then there will be an opportunity or a topic. It's like, oh, that's what I should do. And you jump on it. So I think that that's a great opportunity and a great way to keep in touch and bring these people together.
Thanks. Gila, anything to add on that?
Nothing to add except that I'm really curious to hear from the audience what they see as opportunities or things that would be practical or responsive, or what are issues that folks in our audience would highlight as key. I see meat consumption as a big one, and I will say it was interesting. Just as an aside, I just learned, because I've been in these National Academy workshops for the last 3 days on climate change and environmental health broadly, and thinking about the future of environmental health, where that future is sort of all of us having an environmental health perspective in sort of everything we do. And I'm seeing this now, even though the New York Times has these climate updates, these daily climate updates, and the Washington Post has these environmental alerts. These are all new things. I that are just becoming mainstream and daily to sort of insert this perspective. But I guess I'm curious, what brought people to this webinar? What's motivating people? Where are their interests that we could be responsive to? Oh, and the point, sorry, and while, to hold your thought, David, where I was going originally was that the methane emissions from cows, and like, yes, they are the most toxic, but they are the more shorter lived compared to the carbon emissions. And so that's why the focus on the carbon, I guess. But I just learned that. And so it does kind of bring up this whole issue of like time horizons and thinking about not just the immediate effects of your exposures, but also sort of the long term and how do you balance those? It's a hugely complex issue.
Yes, absolutely. And so again, request issued to the group to add things in chat. I do want to pick up on a few other questions that are already in the chat. One of them further along this notion of engagement, and just asks whether any of you know whether there are people who have begun to engage island nations, U.S. territories like Guam and Puerto Rico in these discussions, given that climate change can impact islands where cancer care is lacking. So any just thoughts about some of those specific partnerships or engagement efforts that have come up?
You know, I don't know of any directly related to climate change, but I see Virginia Sun was on here at least at one point, and I know that she and I have worked on a SWOG trial together that she's the lead of, where we have actually engaged through SWOG with Guam patients. They're for a very different purpose. However, I think it shows that there are opportunities with cooperative groups, maybe even, that are engaged with Guam and the Pacific Islands, that we could begin to think about an infrastructure to start to move this conversation forward. So kind of borrowing the science from someplace else, right? What could we do? I think there is infrastructure, but I don't directly know. I would hope that this is a conversation that's being started. I can't think of any other direct examples though, but it's a very important point.
And it looks like, just from scanning the chat, that we may have participants who can follow up with one another over sort of shared experience and history in Guam specifically. Anything else in terms of island nations, Leticia or Gila?
Yeah, I think that we know that island nations are especially vulnerable. We saw a lot with Hurricane Maria in Puerto Rico too. And there's been huge devastation in the Bahamas recently. And I think that a lot of times when you're closer to the problem, you're also closer to the solution. You've been living with this, you've been trying to solve this. So I think, as Tracy was saying, there's huge space for collaboration and lessons learned on different interventions. Of course, they're context dependent many times, but definitely lessons learned from these communities that are more vulnerable. I also saw something in the chat about recycling that I think was interesting, because you're asking about the implementation of them. And I think that there's been a lot of conversation about, as we know, only 9% of what we put in the recycling bin is actually recycled. And the healthcare system produces a huge amount of waste. And I've started to hear more about all of the toxic and carcinogens and hazard pollutants that are emitted throughout the plastic fabrication and waste. So I'd love to hear more from Tracy and Gila too on that, because I've started to hear people saying, I wish recycling would go away, that concept would go away, because it doesn't work. You feel good when you put it in a recycling bin, but it's not going to be recycled. And as you were mentioning, the implementation, what were the thoughts about focusing on recycling there?
So Tracy or Gila, anything you want to add? The specific mention about recycling, I think it also tied in how we communicate about some of these efforts being incredibly important. Tracy or Gila?
I guess my only comment on this would be we'd have to be very careful about how that message was crafted. I don't think hardly anybody knows that, Leticia, about recycling I can see it once you say it, but I'm not sure many of the public knows this information. And I think there's been such a push, and I saw a comment in the chat too about educating children about this and the policies and the things that are happening. You know, if you think about it, reduce, reuse, recycle was something that we were taught in school like over and over and over and over again. It was a major campaign. And so I think it would have to be very carefully done how that message came across, because you wouldn't want to come across that it just doesn't matter at all, right? But rethinking and re-educating the community is a sensitive thing to do. I think COVID has taught us that too, that, you know, misinformation and messaging matters and where it comes from. So I would think that needs a lot of critical thought, but I think it's an important point because, you know, lots of people, you're right, Leticia, they feel great, they put it in the recycling bin, but what's really happening beyond that? So I think it's a really good point.
I think this also gets to the question of who should be our target audience at this point. Is it about direct to consumer messaging, or are there problems with our recycling systems that we can get consumers to recycle all we want, but actually it turns out a lot of that recycling is going into the trash. And so maybe we need to be focusing at different levels. Going really quickly back to the island nations and islands in general, I'm going to put, just to mention for folks, if they're interested, 2 articles in the chat. One is our colleague, Ana Patricia Ortiz from Puerto Rico, who was on this ASPA session with us, who's done some really interesting work looking at disruptions in cervical cancer screening related to the hurricane and other disasters. So I'm going to put a link to that in the chat. But also, not cancer related, but climate change and health and implementation science related, is work on in Pacific Island nations around these forecasting systems and implementing forecasting systems related to a range of health areas. So I'll also add that.
Great, thanks for that. And I do see Soraya has a note in the chat as well about working in the Caribbean, specifically around chronic disease, climate-induced disasters with implementation science methods. So another opportunity for folks to connect. I want to go back because I think that at various points, the notion of data systems had come up, and I saw that there was a question, I'm scanning back and forth, that talks about a critical dimension in evaluating climate change related population health is the location-specific quality of life impacts on cancer care patients and providers. There are many direct and indirect hazards to consider to assess meaningful interventions. And the question for the 3 of you is whether anyone has any thoughts about implementing what would likely be these data-driven interventions to try and do this assessment and then identify both what the challenges are and then what solutions might be. And Gila, I don't know if what you were talking about in terms of some of the data systems was it in the Caribbean? Is that what you were?
Actually, a whole range of places all over the globe. So it was in the Marshall Islands, in Peru, in the Amazon, in Micronesia, anyway, a range of places where they were looking, in India, looking at these forecasting systems, and Ethiopia, right? They're all coming back to me. And I think one of the challenges there with these forecasting systems is, you know, stakeholder buy-in, and those stakeholders are multi-sectoral. And this is, you know, this was something we highlighted at the D&I conference last year, these multi-sectoral collaborations, that if you want to impact health, you have to recognize and work with the various sectors that you'd rely on to do that. And in the case of climate change and cancer, you know, one of those sectors is meteorology, weather services. So a challenge is getting that data and getting those data from both tracking the public health systems as well as the meteorologic systems. And, you know, for example, one interesting challenge there is that the unit of analysis, it's the way the data are collected, it's different. So it makes it challenging to have a system that operates in a way that you can predict for the appropriate geographical unit. So just as one example of an implementation, a data system challenge related to implementation of a system. Yeah, I'll stop there.
Great. Leticia or Tracy, any other thoughts about the sort of data system approach toward thinking about both assessment and what to implement?
Yeah, I think that it's a huge opportunity here. So I think all states have several different cancer registries, even mental health registries. But however, these are not used in both steps. Whenever we know that there's a storm coming, for example, to identify vulnerable populations, individuals who are undergoing cancer treatment, for example, would be extremely helpful. And then after a disaster strikes, what kind of shifts that happen or health impacts have occurred so that we can plan better for the next one. I think that there's a huge role of data here. I think that there's several national health surveys, for example, that could also help us better understand. They have been instrumental in our understanding of so many environmental risks, but none of the current health surveys either link with FEMA data, for example, to identify disasters or ask questions about person's experience with these extreme weather events. And now we know a huge proportion of the US population has been impacted by at least one of these. And then there is again, at another level, the institutional level, we know very little. There is no data source for what kind of emergency preparedness plans are being developed or for evaluating are they're working, what kind of adaptation strategies working best. So we don't have any lessons learned. But there's the individual level data and institutional level data that I think would also be extremely important for better understanding our ability to prepare and respond to.
Thanks, Leticia. Tracy, anything you want to add?
Yeah, no, I just think that there are these data points that we've been collecting that live in different silos that I think there are opportunities to overlay and marry together. One of the projects that I think about that's being done here at Miami, I think Kalan Assad Bishop's on this, or she was on this chat, but she's looking at surface heat temperature, and how that may be playing a role. And so we know, unfortunately, gentrification is happening, and there's something called green gentrification or climate gentrification that's also happening. And so when that happens, when flooding and disasters strike Miami in particular, it just so happens that some of the higher ground, so to speak, is also some of our lower socioeconomic status communities that, because they're in higher ground, it's now more desirable properties. And so things that are happening, thinking beyond your traditional linkages for cancer, like, surface temperature, and like, I love what Leticia said too, we may have the opportunity to pre-post an event, we know that these events are happening. And again, I would challenge those who don't live in communities that are on the coast to even think about when wildfires happened. And, these are opportunities, and the data are there.
Great. Thank you for that. It ties in, I think, to a question that I saw in the chat as well, is how agencies like the NIH are supporting research in this area. Gila, you may want to spend a moment just talking about our ongoing broad announcements around dissemination implementation research, which also covers the implementation science terrain. But yeah, if anyone has any specific thoughts about existing funding opportunities, Gila, do you want to say something about that?
So exactly, and I think NIH has been this trans NIH group has been thinking a lot, but in terms of what's open right now, we do have these trans NIH implementation science funding opportunities that are not specific to a disease area or to a problem. There are 22 institutes, centers, and offices signed on. That includes NCI leads these, but NIEHS is signed on, NHLBI is signed on. And you can see the whole list of others. I'll put a link in the chat. But this is an opportunity to fund implementation science research that could focus on climate change and these related issues, for example. So those are open now. As I said, in terms of sort of the evidence to inform that implementation science, we have that funding opportunity that I already posted that's looking at the impact on healthcare delivery related to climate change. So those are some open funding opportunities. And like I said, I'll share a link to the chat. I also saw a whole bunch of other great questions in the chat, David, that I hadn't noticed before. I don't know, I will. And I also saw that Millie posted a link on the Caribbean, so that's great. But I'm gonna grab the DNI PAR link to put in the chat, and I wonder if we can turn our attention, unless folks have to add, to Virginia Sun and Stacy Loeb also posted some things in the chat, maybe others.
So yeah, so thanks, and thanks for everybody for continuing to put stuff, really great comments. Stuff it doesn't do it justice. Great comments within the chat, yeah, including Stacy's, which I think might be for us all to be thinking about a little bit more, as we're somewhere in the state between having, well, there's a piece of it for us in the scientific community, some way in which we think about the way in which we communicate, we congregate, has its own environmental factors, and then the way in which some of the industries that we work with may be unhelpfully contributing to the same problems that we've heard from our three experts talking about. I also want to note that there was another thing in the funding opportunity, or the mechanisms, what to leverage. There was a note about leveraging some of the cooperative groups who have infrastructure to conduct a range of different studies and might apply that infrastructure to thinking about climate change and cancer. I do just, yeah, let's see, because we're just a couple of minutes before the end of this really awesome hour. I do want to just try and see for a final question. Maybe it's a broader question. And again, great chat. We're pulling it together. We'll keep mining it and encourage everybody to connect with one another. But wonder maybe as a final question to each of you. So much that we need to be thinking about, so many opportunities for ways in which we can learn and ways in which we can address these enormous challenges that seem to get daunting as time goes on. I wonder if each of you might just take a moment to say, what do you feel, if you're talking to a captive audience that's interested in where do I go next? Maybe the final question for each of you is, what stands out as if you could encourage people to think, for your next idea, might you consider X? I'm curious as to what X, or whatever letter you'd like to put in, might be. And maybe we can start with, I'm just in order of what I see, Tracy, and then Leticia, and then Gila to close us out.
Okay, so David, am I allowed to have like two from two different perspectives?
X and Y, absolutely, multi-variable.
So one, for anybody that's at, or anybody who's part and a member of their cancer center, to bring this to the population science, to bring this to COE, to bring this to the table. I think it's going to take many voices across us to bring climate change to the forefront for cancer centers. So that's my first push. My second push would be to go to our communities. I think Leticia said something that was so powerful, that the people that it's happening to directly oftentimes can give us the best information about what's happening and where the needs really are. So I would just advocate for going back to your communities too.
Thank you. Leticia.
I love that question, and I love it because it is diverse. Each person in this meeting is going to have a different one. So my suggestion for what to do next is look around, try to think about the overlap of the solutions, right? We've been measuring this problem, but there's an overlap of solutions that we're talking about, right? Consumption and fossil fuel emissions. Look around in your sphere of influence. Where do you think you can have the greatest impact? Is it for meat consumption at your institution? Is it bringing climate change as a symposium to your institution? Is it starting a study on an intervention or the implementation of recycling? Is it talking about your emergency preparedness plans? Each person here is going to have a different one. So I would like to, my suggestion would be, which is your lowest hanging fruit, and act on that right away.
Great, thank you. Gila.
Yeah, and just to briefly echo that and add to one of the comments in the chat, that, you know, if it's organizing a scientific meeting, and do you try to have a hybrid model to incentivize limiting travel. So just as another example, I think for me, what I'm most, this might not be really answering your question, David, but it's just to see such an engaged audience. What I'm really eager to hear is just getting more information from people on what they're motivated to do and to explore and to try to build this community, because it seems like there's a tremendous amount of interest and motivation and enthusiasm for it. And, broadly, there's several of us who are trying to grow implementation science in the environmental health sciences community broadly. And I think there's a lot of opportunity for implementation science to learn about building proactive systems and forecasting systems. And basically my final word is email me your ideas. I'll do my own RFI, personal RFI. And really excited to see that there's so much interest across the NIH in this space. I think there's a lot to come, I'm hoping.
So all good fireside chats end with commitment to continue the dialogue even beyond the hour that we have together. And so thanks so much to everyone in the chat. Thanks especially to Leticia and Tracy and Gila for their sharing of their expertise. Thanks to everybody who's already volunteered to connect with each other individually, collectively, because of course there is a lot to do, and we appreciate your interest today and for the foreseeable future. With that, Denise, I'll hand it back to you to close us out.
Sure. Thank you to our speakers for a great conversation today. And as a reminder, an archive of today's session will also be available shortly on the Implementation Science Series webpage, which is up on the screen right now. Thank you again, and everyone can disconnect, and we will see you at the next webinar.